serious, isn't it? Because, Matt Hancock naturally is talking about, how quickly we're getting the vaccine to people, how many people are getting the vaccine every day. Do you think people are being sat down and told exactly what getting the vaccine means? It means you're much less likely to get anything that's serious, but it doesn't make necessarily any difference, as we've just heard, to how infectious you could be.
Well, I think it's very important that the communication around this is clear. And here at the Linden Center for Risk and Evidence Communication at Cambridge, we've developed some guidelines for ethical and trustworthy communication. And that includes conveying the quality of the underlying evidence and the uncertainty around some of the numbers. So, for example, it's very important that we pre-bunk misconceptions or misinformation about the virus. And by pre-bunk, I mean preemptively convey this information to people rather than trying to correct it after the fact. But we can also be transparent about the uncertainty around some of the numbers. So, for example, even if you take the Pfizer vaccine, which is 95% efficacy, that still means that if you're vaccinated, 1 out of 20 people might get ill. There's some uncertainty around that number. It ranges from 89% to about 97%. So it's important that people do understand that even when you're vaccinated and it's safe and effective, you don't have immediate immunity.
No.
It takes a while. And you can still potentially spread the virus to other people, and the evidence around that is still evolving. So yes, it's very important that we
and I know you're working on this, and your sense is that the government is concerned about this at the moment.
Well, we've worked with the Cabinet Office, for example, to launch interventions to pre-bunk misinformation about COVID-19 vaccines. We have an educational game called Go Viral that anyone can access and play. And we're talking about how to best communicate this evidence. We have 5 rules for evidence communication, and you can use an acronym called PROVE to remember it. Pre-bunk misinformation, reliably inform people, offer balance, but not false balance, validate the underlying quality of the evidence, and emphasize uncertainty.
But you're a behavioural psychologist. When you have things, simple messages like stay at home, protect yourself, and save the NHS, we don't have yet a similar message for the vaccine. We don't have something that's very simple and clear for people of all generations to understand.
Well, maybe a simple rule of thumb would be that even when you're vaccinated, behave as if you're not vaccinated, which means social distance, wear a mask, follow public health guidelines. The safest thing to do, even when you're vaccinated, is probably to still act as if you're not vaccinated to protect yourself and others.
Professor Dunn Walters, is it possible, of course, that if we do not get this message,